Critical Healthcare Management is a pharmaceutical and laboratory company based in Dallas, Texas. I think it's very telling that our mission statement is a perfect platform from which to address the needs of the Department of Defense, combining science, expertise, our people, and our passion to innovate patient-centered solutions. That's what this is all about.
If there's any group of patients that could greatly benefit from this testing, it's our soldiers. This group has put themselves in harm's way, sometimes suffering significant psychic pain or physical pain because of what they've done to protect American citizens. Using this kind of testing, we can give back to them, provide state-of-the-art healthcare at affordable prices. The ultimate goal of this partnership is to improve the lives and healthcare of our nation's heroes. Pharmacogenomics is the application of the human genome to individual patients for maximizing their response to medications, for medication safety and correct dosing, generally making medications work better for patients. The interesting thing about psychiatry and pain medications is that within drugs of a certain class, the different enzymes in our body, different pathways metabolize and get rid of and absorb these drugs differently. Pharmacogenetic testing could be seen as sort of a GPS system, guiding the doctor down the right path with the right drug to get that patient the treatment, the relief they need as fast as possible, as efficiently as possible.
That's what pharmacogenetic testing is all about. It gives you a roadmap to understand the benefit of the medication being used, purely and simply. Our country and the military face an enormous challenge in crisis with healthcare costs. There is an inordinate number of patients within the military that are being treated for psychiatric problems. There's abusive reliance upon opiates.
His doctor offered him all kinds of pain medications, but he stopped taking them because he didn't want to get hooked.
And I was telling him, like, I'm tired of popping 6 pills, 8 pills a day, you know? Like, I don't want to deal with this.
Pharmacogenomics is a very important tool to provide the right pain medication at the right dose to the right individual. And in some cases, they can avoid opioids altogether, prescribing alternate medications that can serve just as well.
So again, better outcomes and cost efficiencies because you're not prescribing medications that will have no or adverse impact.
More importantly, it can keep those veterans who are a national treasure healthy and happy with their families. They can live longer, better lives. This would be done because of this guided therapy.
The fact that 1 in 6 military members is on some form of psychiatric medication is a huge number.
One of the most important areas that pharmacogenomics can be applied to is in psychiatry. Turns out that there are dozens of different antidepressants and antipsychotics because no single drug works for all patients.
Instead of going through a trial and error process, you understand what medications work and work most effectively for the benefit of the patient.
Taking on this project is going to be an incredibly exciting challenge for me. I've run labs in the past, specifically in this kind of testing. I've built up labs with a capacity to run up to 10,000 a day. Using such systems, I've run over 190,000 patients. Using my software, we've diagnosed and provided roadmaps for all of these patients. What we're doing today is improving upon that system. Our capacity could increase to 20,000 per day. We would be using expert technicians. This would be done at a scale that's unprecedented. And I know I can do it because I've been there before.
We are honored and excited by the opportunity before us of serving our nation's heroes. And as a consequence of military service, they oftentimes suffer physical problems that can last with them for the rest of their lives. Bottom line, the opportunity to provide some help in more effectively dealing with those types of problems is very exciting to us.
A simple 5-minute procedure to collect the cells needed to carry out this testing can yield a lifetime of benefits.
We're excited about the opportunity to be before you and would welcome the opportunity of working on behalf of the Department of Defense and our national heroes. Thank you very much.